you basically had he said a word before this, and he said, I can't remember what he called it. He called it like a stem or a stern or something. And he's like, do you know what that is? And I said, no. And he said, it's basically a mini heart attack. You've had a mini heart attack. And I was like, whoa. I kind of laughed. And he said, no, it's serious. So then I was like, okay, wow. But he said you had a mini heart attack during the event or whatever. So that's what happened. So I don't know why it happened or...
Just watched Bailey's little video. Thanks, Bailey, for doing that. Welcome to camp headquarters. Of course, I was in the Torian Pro audience, just lapping up the action, and I, was very disappointed that I missed out on seeing Bailey compete. So all the best to you, Bailey. Hope you get better soon. But after watching your video, really felt compelled to talk to our community a little bit about myocardial infarction. It is a very serious condition. What Bailey was talking about when he was talking to the doctor, and of course this is just for consumption, just for education purposes, don't take anything that I say as medical advice. But I think what Bailey was talking about when he was speaking with the health professional was a non-STEMI, which means it stands, the way you spell that would be non, STEMI, and STEMI stands for ST segment elevation myocardial infarction. ST elevation myocardial infarction. So you can either have two types of heart attacks or two main categorizations based on EKGs, or we call them ECGs in Australia. The Yanks call them EKGs. But what they're referring to there is the labeling of electrical activity of the heart based on the ECG findings. ECG stands for electrocardiogram. And basically when you put these electrodes, as Bailey mentioned, the little stickers across the chest, the electrical activity of the heart is able to be recorded. And when you interpret the trace of the heart contraction, you get a recording like this. And these are labeled the P wave, the Q wave, the R wave, and the S wave. So the ventricular contraction is the QRS complex, which is this part of the ECG trace. And then this here is the ST segment. Okay, this is the ST segment, and that's part of the word that Bailey was using, STEMI, ST elevation myocardial infarction. So STEMI is what he was saying, and he did remember correctly, STEMI, but I think what he meant to say was that he had a non-STEMI myocardial infarction, or a non-STEM myocardial infarction, so non-STEMI, non-STEMI, ST elevation myocardial infarction. So most of the times when people have more serious heart attacks where it's full up, this just shows how you get those electrical signals. So the atrium, which are the smaller chambers of the heart above the ventricles, which are down here, the depolarization of the atrium causes the P wave. The depolarization of the large, thicker ventricular muscle that causes the QRS complex. And then you have isoelectrical activity, not much activity happening in the ST segment, so it's flat. And then you have a recovery wave, which is the repolarization of the large, thick muscle, which gives you the T wave. Okay, so P, Q, R, S, T. Pretty simple. And the electrical activity is just due to sodium and potassium ions moving across the muscle membrane. Okay, and those sodium and potassium charges, the differences between the concentration of sodium and potassium outside the cell membrane is what leads to an electrical charge. Just like on your car battery, the difference between red and black gives you that voltage and the current. So that's how we get the PQRS ECG trace. Now back to the non-STEMI. So here's our non-STEMI ECG trace, and I'm almost certain that this is what Bayley was talking about. Here's your transmural, which means full thickness myocardial infarction. That means heart muscles dying, versus a normal ECG. And here's your STEMI heart attack. So ST elevation myocardial infarction, and you can see the ST segment is elevated. Here it's normal. And then I'd say the cardiologist that were contacted, which is just fantastic that the Torian Pro has access to cardiologists to give an opinion on these highly complex ECG findings that the paramedics probably did for Bayley while he was experiencing those symptoms and that performance, which was not his usual capacity. That's because he is having a heart attack, most likely, and your heart just can't contract properly and therefore can't push the oxygen around your body into your muscles. And this is what Bayley most likely had, a non-STEMI heart attack, and you can see that there is no elevation of the ST segment. In fact, they've done very well to identify some ST depression, and that's because the occlusion of the blood vessel is partial, not complete, and so you don't get full thickness. Ventricular wall ischemia or full thickness death. And maybe you had a little bit of T wave inversion as well. So, in general, non-STEMI or NSTEMI heart attacks are a little bit more difficult to pick up. And so, look, I think they've done extremely well. It would have been very dangerous for Bayley to have gone back out on the floor. So hats off to you, Torian Pro, for doing such a fantastic job protecting our athletes. That's just wonderful. One day I may even like to be on the medical team. But this is almost certainly what Bayley is talking about, and why he would have had to go to hospital. He would have had to have blood tests measuring cardiac muscle death. That's identified through a test called a troponin and a muscle CK. These are all enzymes that get released from the muscle. Now, we've got to ask ourselves, what's going on? Why does an incredibly fit, healthy athlete have this type of business going on in the blood vessels? This is not because of overtraining or anything like that. This is because of inflammation. And of course, inflammation, metabolic inflammation is primarily caused by excessive insulin, and excessive insulin comes from excessive glucose. All right, so we really want to limit our glucose consumption, because the only way to metabolize glucose is through the secretion of insulin, right? So that's what my advice would be to anyone who comes to see me about metabolic health. Is I'm just trying to find where they talked about causation, and they did have glucose and sugar on the causative effects for coronary blood vessel narrowing. All right, so maybe I saw it somewhere else, but anyway, limit your sugar intake. That's recognised as the inflammatory model for coronary artery disease. Not fat, not cholesterol, sugar. All right, non-STEMI heart attack. That's take-home summary of what most likely happened to poor old Bayley Martin, one of Australia's best CrossFitters. All the best in your recovery, and I'm sure we'll see you back on the floor. Just let your heart recover. Take care.